Okay. Well, hello, everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. For those who don't know me, my name is Dr. Nkeiruka Duze, and I help people with joint pain and autoimmune disease get their immune system back on track and become pain-free so that they can live healthy, active lives. And I am so honored to have my dear friend today. Her name is Dr. Nkeiruka Duze. And Dr. Duze is a trailblazer. This is going to be an amazing interview because she has so much to share on very important information. She's in the greater Seattle area. She is a leader. She is a magnet. She's a mentor. I am going to let Dr. Duze, my dear, special, brilliant friend, introduce herself, and let's get this show started. Thanks, Dr. Duze.
Well, Dr. Dada, that is quite very generous, I would say, introduction, and thank you. So as Dr. Dada shared, my name is Nkeiruka Duze. I'm a primary care physician in the greater Seattle area, and it's truly a privilege for me to have the opportunity to share with you today.
Thank you, Dr. Duze. Can you tell us a little bit about yourself? Primarily, why do how did you how did you why do you do what you do? Like, I already know you're passionate about what you do, but why do you do what you do? And tell us a little bit about how you got here.
Well, I'll start off by saying that, at the age of 12, I knew that I wanted to be a doctor, and part of the reason that I, was really pulled to this path or career is that growing up, I had epilepsy. So I certainly was on the other side of things, being a patient, for a very long time. And just, being on the receiving end of great care and seeing how that great care not only impacted me, but certainly my family members who were impacted by my illness helped me to realize that I wanted to do this, for others. And, that has also translated into the way that I practice medicine currently, which is, anytime I see a patient, anytime I'm given the privilege to partner with or care with a patient, care for a patient, I always think about, if this were my sister or my brother or my mother, what would I do and how well will I take care of them? So really, from a very young age, being a patient myself, medicine became and has remained my passion.
Wow. Thank you for sharing that, Dr. Duze. And I think what resonates with us as physicians is the fact that we're partnering with our patients, right? It's not that top-down approach. It's that we are kind of like Obi Kanobi, and we're going to be the guide, and we're going to partner so that the patient can get to their goals and helping the patient to really see that vision. So thank you for really illustrating that again as kind of part of the way you practice, which is that partnership relationship. But I'm going to add a little bit more because Dr. Duze is very modest. She's been practicing for nearly 2 decades. I know you can't tell. And she is an expert in preventative medicine, geriatrics, and women's health, in addition to all other kinds of things. So that's going to form a little bit of the basis of some of the questions that I think are burning questions for people. And we have an expert in town. So let's start. So we're going to talk about cancer screenings, right? And my first question, Dr. Duze, is why is cancer screening important?
So that's a really great question. And I will start off with the context that when we talk about cancer screening, we're really talking about, performing tests in individuals who don't currently have any symptoms. So there are two reasons that cancer screening is important. The first is we do want to identify cancers early before they spread outside of their site of origin. And as you can imagine, that is really important, with regards to outcomes, whether it be being able to treat or cure that cancer. The second reason that cancer screening is important is that it also helps us identify precancerous lesions. So what I mean by that is even in an individual who you didn't identify cancer, you might find something that puts them at higher risk for developing a cancer, and you then shift and begin to screen that individual at a more frequent, cadence. So that I would say is the reason that cancer screening is important.
Could you give us an example of precancerous, because I'm not sure that most people fully appreciate that. Because I think if we understood that there's some things that are precancerous,
Right.
then I think it may help us to understand better the importance
Yeah.
of the screening.
Yeah, absolutely. So an example when I talk about precancerous would be an individual who has an abnormal pap smear, for instance, and it showed that they have dysplasia, which is where the cells are not looking like they meet the criteria for cancer, but those particular cells do not look normal. So in that individual that has now been identified as having dysplasia or or have cells that don't look normal, that individual can now be screened more frequently compared to someone who had a pap smear and that pap smear was normal.
Yeah. Okay. Okay. So there is an action to be taken. It's not cancer, but those cells are kind of looking like they want to be cancer. And so we need to kind of get on top of them, monitor
Right.
them, and
More
allows us to
frequently.
take action faster before they
Absolutely.
morph into the beast, right?
Absolutely.
Okay.
Absolutely. Yeah.
Okay. So which cancers, as we talked about that,
Yeah.
then the next question that I'm thinking about is what cancers should people be screened for?
That's a great question. So, the typical cancers that we screen for, the first is breast cancer. The
Yeah.
second is lung cancer, but in select individuals who meet criteria for lung cancer screening. We also screen for colon cancer, and we also screen for cervical cancer in women and prostate cancer in men.
Okay, let's talk about the lung cancer. I think people know that they need to get their mammograms. People should kind of check their
Mhm.
prostate. People know that, and
Yeah.
people know that they should be getting their colonoscopy because Black Panther died from colon cancer.
Yes. Yes.
So people know
Yeah.
they should be getting their
Yeah.
colonoscopy.
Yeah.
I think the lung one is what people may not really be, pretty conversant with. Can you tell me a little bit more about, how that comes about? Who is
Yeah.
at risk?
Mhm. A great question. So we typically screen for lung cancer in individuals that are age 50 to 80 who have a 20-pack year smoking history. So that's
Mm,
like, one pack a day for 20 years, who either are still smoking or they quit smoking within the last 15 years. And if we identify that, category of
okay.
individuals, what we do is a low dose CT scan every year, looking for lung
Okay.
cancer or
Okay.
lesions, which can then be biopsied to ensure they are not cancer.
Interesting. Huh. So so when we say 20 pack years, it could be one pack a day for 20 years. Is there another variation of that?
So it could be like, I would say, half a pack for 40 years, and
Yeah.
thankfully we don't have to do the math. We have calculators that help us.
Is that 4 packs for 5 years, right? 4 packs a day for 5 years.
Yes, exactly. So
Yeah,
yeah,
so yeah,
yeah,
whatever you multiply your packs for the number of years. Yeah, so if you say,
right,
oh, I'm only, because you know how people are, they're like, I will only smoke for 5 years. They're like, well, how
correct.
long? How
Yeah,
much?
yes,
How much did you
yes,
smoke, right?
yes, yeah,
Yeah, I think we all know
absolutely.
smoking is bad, right? And it's
Yeah,
also bad for your lungs. It causes
yeah.
rheumatoid arthritis, by the way.
Oh, wow. Yeah.
Yeah,
That's why
nothing good
we
with
encourage
smoking.
patients and partner with them to help them stop smoking,
Yeah.
because when they stop smoking, it does decrease their risk.
Yes, it does. And it does even for a lot of autoimmune diseases in my world too.
And other
And
cancers.
yeah, and I'm appreciating the fact that it is hard, right? It's
Mhm,
not nobody's saying quit, kick the habit, and I mean it's a process.
mhm.
But talking to your doctor can actually get you there, right? Even
Absolutely.
reducing, is there
Yeah.
any point in even reducing the quantity of
Oh,
cigarettes that
absolutely.
you
Absolutely. Absolutely. Yes.
smoke? Okay. Okay. So when should screening begin?
So that's a $1 million question. So that's the a really great question. So typically, to answer that question about when cancer screening should begin, there are three pillars that we need to focus on, or three questions that we need to answer. The first is, what is your patient's age? That's number one. The second is, what is your patient's personal medical history? And the third is, what is your patient's family history? Right? So, and I'll give an example. And the example I will use is colon cancer screening, for instance. So, when we think about age specifically, that first pillar, um, so an average individual, who does not have any known conditions that increases their risk of developing colon cancer, that same individual does not have a parent or sibling with a history of colon cancer, that average risk individual would begin, colon cancer screening at age 45. Okay,
Yeah.
so that's the first pillar, which is age.
Yeah.
The second is personal medical history. So in an individual who has a personal diagnosis of an inflammatory bowel condition, so something like ulcerative colitis or Crohn's
Yes.
disease,
Mm-hmm.
so that individual, because we know those conditions increase their risk of colon cancer, that
Yes.
individual will begin colon cancer screening 8 years from when they developed their inflammatory bowel disease
Yeah.
symptoms, right? So they wouldn't wait
Okay.
till they're 45 if that
Yeah.
age comes later, right? They would begin
Yes.
colon cancer screening earlier. And then
Yes.
last, certainly not least, is that family history pillar, right? So in
Yes.
an individual who has a parent or
Yes.
sibling with a history of colon cancer, that particular individual will begin colon cancer screening at age 40 or 10 years before their family member was diagnosed, whichever
Yes.
comes earlier, right?
Yes.
So to answer the question of when to begin, cancer screening, when patients go to see their doctor, the information your doctor needs, your age, your
Mm-hmm.
personal medical history, and then your
Yes.
family history. So those
Yes.
three
Yeah.
pillars will help your doctor come up with your cancer screening plan.
That totally makes sense. And and just to clarify, because I know that in recent years, because we're kind of re-looking at colon cancer, there was a change, right, in the screening recommendations.
Yes.
Can you tell us a little bit about what changed? Because I want to make sure that, because people will go to their primary care doctors,
Yeah.
and some docs may or may not be kind of up to date with the change. And so I think it would be helpful for patients to kind of have that information that, yes, it used to be a certain time. I'm going to let you take over before I
Well,
go into
absolutely.
that list.
You're spot on, Dr. Dada. So for years, the recommendation in terms of what age to begin screening for someone that is considered average versus increased risk of colon cancer, the age was 50. But
Yes.
at some point, that age was then decreased to 45,
Yes.
which is the current standard.
Yeah. Okay. So that's helpful, right? Because when that way, people can say, hey, yes, you're right. The recommendations doc was 50, but now it's been changed to 45, and then that person can
Correct.
look it up rather than, just being blown off. Okay, perfect.
Absolutely.
Because, yeah. So, and then, what about pap smears? When should that start?
Great question. So cervical cancer screening with pap smears should begin at age 21.
Okay. 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 And then how frequent?
So great question. So in patients that are between the age of 21 and 29, we perform, pap smears for cervical cancer screening every 3 years. And then
Okay.
in patients that are 30 and older, we typically can either do a routine, pap smear every
Yeah.
3 years, or
Okay.
you could do co-testing with the, pap smear and HPV testing every
Yeah.
5 years, or just
Mm-hmm.
HPV testing every 5 years. So depending on if you're doing just the cytology or cytology with high-risk HPV testing, that
Yeah.
determines the frequency in those that are 30 and older.
Okay. Okay. That's helpful. Okay. Good. So you have just this wide range of experience, and I know I hate to narrow you down to just one story, but would you mind sharing, because sometimes we see ourselves in other stories, right? And so would you mind sharing a story of a patient who had an amazing outcome after the benefit of working with you?
Thank you for that question. So, and you're right, it's challenging to narrow down or pick one particular story to share. However, I think I will pick a story to share that ties to our conversation today, which is cancer screening. So in my previous practice, I had a patient who had been my patient for many years. And for years, I would try to convince her or encourage her to have mammograms for breast cancer screening. And she would decline every year because she had several concerns about the way the test was done, the risks of the test, and just did not feel comfortable despite my reassurance. So this was our usual routine. Every year when she would come in, we would have the conversation, and she would decline. And then, a few years before I moved on from that practice, she had come in as usual for her yearly checkup. And we were just chatting, even before getting into the medical discussion. And I can't recall now how we ended up at this conversation, but the topic of swimming, came up. And she was so surprised to learn during our conversation that I did not know how to swim. And there was a reversal of roles in the sense that for years I was on the end of trying to like encourage her, about the importance of getting this mammogram. And now there was a reversal where she was now encouraging me about the importance of this life skill, the importance of learning how to swim. So after our conversation, I said to her, if you get a mammogram, I will sign up again for swim lessons. Yeah, and I was so surprised.
Good job.
She agreed. She actually agreed, and that was so touching for me because it meant to me that she cared enough about me learning to swim.
She cared,
Yeah,
yeah.
that she was willing to
Yes.
get a mammogram.
Yeah.
Now, she did get the
Yeah.
mammogram, and interestingly, it did show a spot which ended up needing to be
Oh,
biopsied.
wow.
She ended up being diagnosed
Wow.
with breast cancer, thankfully caught early.
Oh,
So
wow.
she had a
Wow.
lumpectomy and radiation and did very well. And, she was so grateful. And she said,
Wow.
if I hadn't done this mammogram, it is possible, right, that by the time it was found, it would have spread outside her breast, which is true because it is possible that by the time either a breast lump was evident or by the time she was having symptoms from a metastatic breast cancer, while she can still have options for treatment, it changes her course. So that would be, one example that I share of a patient who, just because of getting the screening, I think ultimately changed her outcome.
Oh my goodness. Wow, that is fantastic, actually. Like, I think on multiple levels. One, that you're swimming now. Two,
Well,
two, just looking at the role.
the role reversal. Well, I will correct you there and say that I did keep my end of the bargain of signing up for swim
You did.
lessons, but I am
Okay,
not
fantastic.
I'm not swimming now because
You're not swimming on the Olympics, right? Right.
well, no, I didn't do well in the swim lessons, and I still
Mm,
sadly can't call myself a swimmer. But I did keep my end of the bargain of signing up for
for
lessons,
the swim lesson.
even though
Wow. But that
I'm not a swimmer
was,
today.
but yeah, but jokes aside, right? I mean, so you were persistent in the relationship, right? You didn't just, and I think people sometimes like would not come and see their physician because they have a different opinion from that physician, right? And you may be like, oh, she's always wanting me to do my mammogram, and I don't want to do my mammogram, so I'm not going to come in. But kudos to your relationship with her. She felt comfortable enough to come in and say, no, I don't want to do my mammogram, and be open to the discussion. And when there was this opportunity where she could encourage you, and then she was now the guide, right? And then she could say, okay, you know what? How am I going to encourage this Dr.
Yeah,
Duze to go swim? And like, oh, I just have to do this mammogram. Fine, I'll do it, right?
right,
And
right.
that then opened this door to basically saving her life,
Yeah.
right?
Well, yeah,
So,
and you're
yeah.
spot on in that. I think it's really important how we have conversations with our patients.
Yes,
So because if the conversation is not carried out with respect, and
yes,
don't actually let the patient know that, we value, their opinions and we understand their concerns, right? If the
yes,
conversation doesn't, exude respect, I think, then the patient is not
yes,
feel comfortable coming back and they may not feel comfortable
yes,
having that conversation on a routine basis. So I
yes,
always make sure that I preface
yes.
the conversation. I know we had this, conversation, last year, but if it's okay with you, I thought maybe we can go over it again this year in the event,
Oh, you're
in
so
the event my
nice.
thoughts about
Oh,
it have changed.
yeah, well, I can so understand why you have, why your practice is has boomed, and in fact, it's full right now. So we can't really have people call you to make appointments because your practice is close to new people. But in future, if it does open up, we're gonna have you back.
Yeah,
We're gonna
absolutely,
have you back.
absolutely.
Yeah. So, any last words for our viewers before we let you go?
Yes, and thank you for asking that. So, my call to action to everyone that's taken the time to tune in and to listen is twofold. The first is, even though you feel fine, even though you feel well, which is my hope for you, I strongly encourage you to make an appointment to see your primary care provider once a year for your annual checkup and your cancer screening review. And then my second encouragement is if you have any symptoms, please don't ignore them. Pick up the phone or go onto your patient portal and schedule an appointment to see your primary care provider to address these symptoms. Because just as we don't want to, identify cancers late by not screening, we certainly don't want to identify them late by ignoring certain symptoms.
Yes, 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 yes. Wow, Dr. Duze, you are just you're a breath of fresh air and just a world of knowledge. And I so respect you. I respect the way you treat people, the way you treat patients. And I'm just so happy for you in your career because you're just a shining star for everybody to emulate. So thank you so
You're
much for
too
your
kind, Dr.
time.
Dada. Thank
Thank you
you.
so much. You know, I love you, girl. Thank you so much for your time. Thank you so
Thank
much
you
for
so much
coming
for
on.
having
Thank you
me.
so much for sharing your words of wisdom. Okay, everybody. So if you think this video has been helpful, do like it, do share it, subscribe to our YouTube channel and also our podcast channel. So thank you, everybody, and have a wonderful rest of your day.
Thank you, Dr. Dada.